Is this ptosis? I notice that my right eyelid keeps getting lower and lower for the past few years. Is this ptosis, or do I just have extra skin? What do you all recommend I do? Thank you.
Thank you for your question. You've submitted a single photo and you're asking, is this ptosis? And you're describing a situation where the right eye continues to get lower over time. And you're asking whether or not it's ptosis or is it extra skin? Well, I can certainly give you some guidance on how I evaluate patients like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and eyelid ptosis is a very, very common issue that I deal with in my practice. And so I can give you some guidance as to how I evaluate a patient and what ptosis means in reference to how to address your cosmetic and visual concerns. So to begin with, the definition of ptosis has to do with the relative position of the eyelid margin to the center of the eye. So if somebody has an eyelid that's lower than a normal position, which is typically 2 millimeters below the top part of the color part of the eye, the iris, then below that level technically is ptosis. Now, generally, if people have symmetric, relatively slightly low eyes, but they can see perfectly well, it's often referred to as bedroom eyes, and people get kind of accustomed to that look, and often it runs in families. But in a situation what you're describing, where there's some progression, that is a situation that is very commonly referred to as an acquired ptosis. Now, an acquired ptosis means it means that the onset of the drooping of the eyelid was later in life, and that's in contrast to congenital ptosis. Congenital ptosis means you were born with the ptosis. You may want to look at some old photos and see if your if your eyelid was significantly higher than it is currently, or if it was just slightly higher. Very often people are born with ptosis, but it's mild, and then as they get a little bit older, the eyelid droops down. Now, in terms of whether or not it's extra skin, I would say that based on the photo you submitted, that it's not likely that the volume of skin over your eyelid is contributing to the degree of ptosis. When there is a lot of extra skin over the eyelid and puts a physical weight on the eyelid, we refer to that as mechanical ptosis. Now, of course, an acquired ptosis should be evaluated properly so that no neurologic or other medical issue can be determined to be associated with the ptosis. And the most common cause of acquired ptosis is called levator aponeurosis or aponeurotic ptosis, acquired aponeurotic ptosis, sometimes referred to as age-related. Basically, the reason why the eyelid gets droopier has to do with a muscle, and this muscle is called the levator muscle. The levator muscle is a muscle that lifts the eyelid, like the word elevator. Well, there's a tendon on this muscle called the levator aponeurosis. As people get older, or for a variety of reasons, including genetics, as well as issues such as chronic eye rubbing or the wearing of different types of contact lenses, that tendon can get thin, and so it becomes attenuated, or it separates or becomes dehisced. So the typical solution for an acquired ptosis is a levator muscle surgery or ptosis surgery. Now, this is all determined based on a very specific type of an examination performed typically by an oculoplastic or oculofacial plastic surgeon. The goal is to not just address extra skin, but to address the muscle. In our practice, it is routine to perform this procedure in our office operating facilities under local anesthesia with very light sedation, because we actually want your cooperation during the surgery. There's no pain, but we ask you to open your eyes, and we'll even sit you up during the surgery to see the eyelid level and make adjustments appropriately. So it's deceptively complex, this type of work and procedure, because we're dealing with very delicate muscles and very minimal numbers of millimeters, which can go one way or the other. So it's very important you meet with a doctor who is highly experienced in this area and can guide you as to what is the appropriate plan to help you have your eyes open up and look better, and have you feel like your eyes aren't continuously drooping. Again, it's not, you have to just basically start with a proper diagnosis and then a plan that typically is a surgical plan, such as ptosis surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.